Hello, good morning, everybody. I am Kelly Nerick, and I'm the Director of Products and Services with the Small Business Association of Michigan. And I wanted to thank you for joining the second in our fourth of our agent webinar series. Our first webinar was a couple of weeks ago where we covered our new agent service model, in which we provide you with one source support for your SBAM sponsored quoting, enrollment, and maintenance customers. We also reviewed our new composite rating option, and then Blue Cross shared details on their fully insured conditional management solutions. We did record that webinar, and I can drop the link in the chat so that you have it. And then we will open it up at the end if you have any questions, but in the meantime, you can use that chat feature, and we'll try to address any questions that come up along the way. So I'd like to do some introductions first. With me today from SBAM is Jeff Thomas. He's our Director of Agent Relations. Kevin Concannon is our Director of Small Business Services. And then Amy Van Alstine is our Director of Billing. And also joining us from Blue Cross is Nicole Sherwood. She's the Director of Market Solutions, Strategic Sales Support, and Shannon Nolan, the Channel Engagement Specialist. So Jeff is going to start us off in these first two slides. He's going to review our Agent Hall of Fame program and some of the additional benefits that are available for your customers.
Thanks, Kelly. So as the title says, we're trying to make benefits selling easier for the agent. And we also want to reward the agents that do a good job in partnering with SBAM. So in the last year, we revised our Agent Appreciation Program. We now call it the Hall of Fame. And we made the qualifications easy to understand. And hopefully we will have more participation as the years go by, as people build their book of business with SBAM. So if an agent has a book of business with 200 lives or more with Blue Cross sponsored by SBAM, then they're in the program. If they have 100 lives or more, but they've written 3 new lines of coverage, which could be Blue Cross, Blue Shield, Blue Care Network, our disability and group life insurance program with Dearborn and or Cobra, then that also qualifies. And you see the picture there of Heather Mosier. She is from VAST in an Acrisure agency in Marquette. She happened to be in town for a conference and was able to come into the office to get her certificate and have a picture taken with our president and CEO, Brian. Unfortunately, the rest of the crew that has won got a picture taken with me. So Heather was the lucky one. And we do appreciate all that she has and her agency have done for SBAM. So when an agent gets into the program, they receive a free VIP level SBAM membership, discounted Cobra administration rates for their non-blue and non-sponsored groups. We do social media promotion for the agency, website recognition for the agency. We do have a lead distribution program that they're free to participate in if they would like. And that's where we have people that call in that are members that are looking for health insurance, or perhaps they're not even a member of SBAM yet, but they've heard that we have some products and services that may be to their liking. So they'll call us and see what we can do. And because we write everything through independent agents, we don't write it ourselves. We refer it out to agents in their area. Also part of the program is an interview on the business briefing with Brian, as well as lunch for the agent and their staff. So we've kicked it up a notch this year, and it's turned out to be a successful program, and we're looking forward to continuing it in the future. Kelly, you want to go to the next slide? Mm-hmm. So making benefit selling easier. We offer solutions that the carrier themselves doesn't offer. So On the HR side of things, we have a relationship with our partner, the American Society of Employers, and our members receive savings on employee handbooks, pre-employment screenings, and workplace posters. The American Society of Employers also has education and training courses available in person and virtual. We do have a third-party administration firm for premium-only plans, flexible spending accounts, health savings accounts, and healthcare reimbursement arrangements, and that's Kushner and Company out of Portage. We've had a very close relationship with Kushner and Company for a very long time, and they make their services available to our members through independent agents, and there are no setup fees and no annual fees for those. Probably the most popular thing that we're doing right now with them is the POP plan, because just about any size employer that wants to have their employees' health insurance contributions on a pre-tax basis needs at least a minimum of a premium-only plan or POP plan, and we can get that done very inexpensively. Also, for each one of our sponsored groups, we provide a free summary plan description. You'll get a template, and it's just a matter of filling in the blanks with the basic information required, and then the document is ready, it's pre-approved, and it can be distributed to employees. That's free to our sponsored groups. If it's a non-sponsored group, we do have a charge for that, and it depends on whether or not you're in the Hall of Fame or not. So I think the next slide goes
Yeah.
to.
Yeah, so thank you, Jeff. We also have this is one of our very popular programs that we have in place. It's our free online Ask an Expert service. So any member who is a premium SBAM member or higher, they can log into our website and submit a question related to legal, HR, or cybersecurity. And we have 3 partners that we work with. Mavasi Law, our representative there is Michael Melfi. And then Jeff mentioned the American Society of Employers. We have Tony Kalin there to answer any sort of HR related question. And then if you have a cybersecurity issue that you need some help with Sensei, Raj Patel is available to help and assist with any sort of cybersecurity question. It's a very easy process to submit your question, and they're very quick to respond, usually within just a couple hours, but definitely within the next business day. I also wanted to mention we have a couple of other types of insurance. I mentioned the cybersecurity. We also offer cyber liability insurance. We have a partnership where we work with 10 insurance providers to be able to offer our members coverage. And it's a very detailed process where we dig very deep on what the small business needs in regards to the type of industry that they're in, what type of data is stored on their devices, the size of their company, and we make sure that they're put into the right plan where they have the right amount of coverage, but they're not paying too much. And then we also have the workers' compensation coverage through Accident Fund. That is a 5% premium discount, and then they're put into our group dividend program where they earn money back at the end of the year. Each year, our members have received a dividend check at the end of the year. So that more than covers the cost of their annual membership dues. I also wanted to touch on our pooled employer retirement plan. Many small businesses have a hard time attracting and retaining talent when they're competing with big businesses that offer a very robust employee benefit package. So we're here to help them add to their package with a 401k plan. When compared to a simple IRA, a 401k has higher contribution limits, and employers have more flexibility to choose from matching contribution levels. And with our pooled plan, we are able to remove some of the challenges that are involved for the employer. They get some tax credits. There are also no initial setup fees, and the employer has a very low level of fiduciary liability. And we also take away a lot of the responsibility and accountability for some of the operational and investment oversight. So if you have any customers that are looking to add to their employee benefit package, this PEP plan is a great solution. So now I'm going to hand it over to Kevin. He's going to go over our in-house COBRA administration that starts at only $35 a month.
Thanks, Cal. Let me start by saying that one of the things I'm most proud of in my years at SBAM is the first-class customer service we've been providing to our members and to the agent community. And that's what you can expect when working with anybody on the SBAM member care team. Now, regarding COBRA administration, we will administer the COBRA for our members for $35 per month. And that is for groups that have an SBAM-sponsored Blue Cross or Blue Care Network plan. And that's good for up to 99 subscribers. We work with all carriers, including Blues, HAP, Priority, United, any of the others. We also work with all of the different dental and vision carriers. Now, our non-sponsored or non-Blue groups, the COBRA fee is $60 per month unless you're in the Hall of Fame, and then it's only $45 per month. But we do work with all carriers. We will send out all the required COBRA notices and notifications. That's all included in the $35 per month. There are no additional COBRA-related fees. Our groups will have access to our COBRA software where they can view monthly activity reports. And if somebody elects COBRA, we'll send them an invoice, we'll collect the premium and send it on to the group. Some other benefits for our SBAM-sponsored groups are we will do the processing in the Blue Cross system. We will do your adds and deletes for you. Simply send a change form to the member care team and we'll take care of it. You'll also receive a combined bill, which Amy will talk more about here in a minute. That'll include your Blue Cross and or Blue Care Network premium, your membership dues, any other member benefit you may have with SBAM, including COBRA. Now, we use iSolve for our COBRA software. And as you may know, they integrate with dozens of different benefit admin systems, including Employee Navigator, but it's certainly not limited to that. There are literally dozens of HR platforms that we'll be able to integrate with. If you have a question, I'll be happy to send you the list to see if what you may have is on it. Now, we have a special relationship with iSolve in that we, meaning SBAM, handle all of the customer service related things that may come up. So your HR people, the account managers, agents, current and former employees, anybody with a COBRA related question calls us and we help them. Okay, that's something we didn't want to lose. And we also do the data entry for all of the groups, so the HR people never have to. Okay, so keep that in mind. Get a hold of me anytime with questions. I'm easy to get a hold of. Amy?
All right. So SBAM is the only business association right now that can put your customers' health, dental, disability all on a consolidated invoice. So for $7.50 a month, we can provide them an invoice that includes their Blue Cross and or BCN group health, dental, and vision premiums, Dearborn Life disability products. We also bill for COBRA administration fees. As Jeff mentioned below, we do work with Kushner on the Section 125, FSA, HSA, and HRA admin fees, so we can bill that on our consolidated invoice, and monthly dues. Our SBAM members can have the option to choose whether they pay their SBAM membership annually or they can choose to pay it monthly. And if they choose to pay it monthly, we will include that on their consolidated invoice. All right, where to send inquiries and premium payments? We process, as Kevin mentioned, Blue Cross adds and deletes. All of your customers can send us in those membership, change forms. For Blue Cross and for Dearborn, they send that to membercare@sbam.org, or they can mail it into our Lansing office, the address you can see here. We will process any of those, any Dearborn claims, we will forward those on to the carrier as needed. Linnea Keeney is our Dearborn guru, and she's excellent at that. Insurance payments, we have a lockbox in Kalamazoo, so we have all of our, if we're doing the consolidated billing, all of those checks go to the lockbox, and then they send us over a file, and we apply those payments to the carrier on behalf of the group. All of your customers do have the option as well to set up a recurring payment. We do pull funds on the 28th of the month. If by chance that falls on a weekend, we will pull on the Friday prior.
Thanks, Amy.
Yep.
We do have an FAQ on our website that gives really detailed information as far as the timing on our consolidated billing. It elaborates more on where to send their payments. So if you would like to access that, please visit sbam.org and then navigate to the member care pages, brochures, and forms. Okay, so thank you, Amy, Kevin, and Jeff. Here is just a snapshot of our SBAM team. We are here to help you with any questions that you have. You can call, email, or visit our website and submit a question that way. So now I would like to hand it over to our friends at Blue Cross, and they're going to share some important information about their product solutions, including virtual care and condition management solutions.
Perfect. All right. Well, Kelly, thanks so much for having us and for introducing me. Before I turn it over to our presenter, I just wanted to say a few words. As we began discussing at the last SBAM agent webinar, BCBSM has many solutions built into our fully insured benefits for group customers. With this series of webinars, we are focusing on providing an overview of some of those solutions that your fully insured customers have with carrying a Blue card. We hope that this information is helpful and that you can share this information with your group customers to drive member engagement while advocating the value of Blue. So now I have the honor of introducing officially Nicole Sherwood, our Director of Market Solutions Strategic Sales Support. Today, Nicole will focus on behavioral health and the care navigation services available through Quartet. In addition, she will discuss virtual care available through Teladoc Health, and which expands options to members for mental health support. I will turn it over to Nicole.
So last time we met, we actually did cover the condition management and virtual care. And so this time I'm going to focus, like Shannon said, on behavioral health care, as well as the care navigation component of behavioral health care. So again, all of these programs are embedded for our fully insured members. So all of your employees should have access. So if we want to go ahead and to the next page. Thank you. So the first thing I'd like to talk about is our mental health self-guided support program. This is a program that's available online, and it offers self-guided tools, including video modules and text-based engagement. This also offers coaching to help members work through everyday life stressors, things like anxiety, depression, and trauma. And the features do include things like behavioral health therapy, skills for coping, processing emotions, skills for parenting in challenging times, and then mindfulness, among others. Employers can use our behavioral health care options flyer that can be found on our Engage page to help promote these programs to their employees. So, can you go to the next slide, Shannon? This slide talks about our program, Able2. So Able2 is actually a national virtual provider network, and they have over 2,500 therapists. So the way this works is they were added to our provider network. So if a member searches for Able2, they will be able to click on Able2 and visit this provider virtually. Because of us adding them to our network, our members now have access to a structured 8-week CBT program, which is the recommended treatment for anxiety and depression. The program includes member access to weekly sessions with a licensed therapist, and it also provides access to digital tools and resources. So if we flip to the next slide, This is our virtual well-being program. I'm assuming you're all familiar with this. This is a very popular program that we have. It's actually available to people who have Blue Care or Blue Cross coverage and those who don't. We want to be able to offer this to basically the whole world. We actually have people from 50 different countries that join these webinars each week. This is a weekly webinar series, and it talks about things like meditation, how to manage mental health. They have really fun webinars. One time they did one on sound therapy, and they do nature walks. It's a really engaging and nice option for members to just take 5 or 10 minutes out of their day and have a little bit of a break. It's designed, like I said, using that public website because we know that people's behaviors are affected by social communities, and we wanted everybody to have access. So on Tuesdays, there are webinars for employers. On Wednesdays, they are guided meditations. And on Thursdays, they offer individual webinars. All webinars are recorded and can be watched on demand. If we flip to the next slide, this is just a little bit of information about our well-being solution. The new well-being program that we have launching with Virgin Pulse in January. Actually, can you flip to the next slide, Shannon? I think, there we go, thanks. The program that we have launching with Virgin Pulse, which I know this slide says WebMD, it's a slight bit out of date. It's now being offered through Virgin Pulse in January. The programs will be very similar though, so the content on this slide is still applicable. We will be offering interactive quizzes for people to assess their risk of depression and other behavioral health conditions. We'll also offer daily cards with topics such as finding emotional balance, anxiety and depression, and then also managing grief and loss. And then we also will be offering what's something that's new. It's digital coaching journeys. These are multi-week programs that encourage our members to complete small tasks, and those help to build health habits. Topics include things like making sense of your moods, taking care during grief, finding purpose at work, and exploring life with less alcohol. Again, there are many facets of our well-being program, but these are just some of the more behavioral health focused ones. And if we go ahead and flip to the next slide, this is just a little bit of information about our collaborative care model. Blue Cross Blue Shield of Michigan does have a collaborative care model, which means the primary care physicians in our network do work with a team of medical and behavioral healthcare case managers, nurses, and then we also work with a consulting psychiatrist to provide care for the whole patient. We, of course, know that behavioral health and mental health is just as important, if not more so, than physical health. And in fact, studies show that when behavioral health problems are addressed, some of those chronic conditions can be better managed and patients get better, faster care. And in fact, it can cost less. So if we go to the next slide, as we talked about on our last webinar, we have partnered with Teladoc Health to provide many of our virtual programs. Today, I just want to talk through a little bit more about our virtual care program. Last time, we talked about that they offer virtual urgent care, but in addition, and what I think is a really nice component of this program is Teladoc also offers virtual behavioral health care. In fact, many of our members use Teladoc as their primary behavioral health care solution. They don't have an in-person provider, they just use a Teladoc provider. This really helps to expand access to behavioral health and offers yet another option for our members. Teladoc has licensed therapists and board-certified psychiatrists, and members, like I said, can access them from anywhere. Members using the therapy services through Teladoc have access to master's and doctoral level behavioral health clinicians, and Teladoc's psychiatrists are trained to deliver care virtually. So they are especially trained through Teladoc. That therapy program, which is is a non-PhD level, meaning they can't prescribe. Those therapists are available for members age 13 and older, and the psychiatry option is for members 18 and older. And if we flip to our last slide, this is a really interesting program we have, and this is a care navigation program that's, again, available to all of our members. This is a program that we work with a company called Quartet. Quartet provides care navigation services, and they work with members to pair them with an in-network provider, but one who meets the member's needs and preferences, meaning if a member has a language preference, a gender preference, an ethnicity preference, and sometimes we know people feel more comfortable with people who have shared experiences. So this is a really nice opportunity because we know when members are paired with people that they have maybe that shared opportunity connection with, they're more likely to engage in that care and stay with that care. Quartet also offers the option for these members to conveniently schedule appointments with the provider through the Quartet team as well. By making it easier to connect with these providers, we are reducing burden on our patients and helping them to better access quality care. So that was actually the last slide. So that's just a little bit more information about our behavioral health programs. As you can see, we have a lot of programs available to our fully insured members. We really hope that everyone is taking advantage of all the information SBAM is sharing in order to be able to share this information with your members so they can use these programs. We definitely want to ensure behavioral health is top priority for us. Thank you so much. And
Well, I really appreciate everybody taking the time. I have this recorded and we will share the link. If anybody would like more information, our website is a great resource, or just give us a call or shoot us an email. Thank you so much. Have a great day.